Hey, welcome back to OT Sophie. Have you ever wondered what an occupational therapy does? Because some have. It gets commonly confused with physical therapy, with recreational therapy. Yeah, I totally get why, because if you look at all those professions, they're similar in some way. However, occupational therapists are totally different. We may work with arts and crafts. However, at the end of the day, it's to help the client improve their functional tasks. I'll give you an example. If a patient, we'll give her a name, Jackie, got into a car accident and hurt her hand, right? Her hand no longer is able to do what it once was able to do. In this case, Jackie is thinking about how to overcome her disability. Jackie is just unable to use her dominant right hand. She's unable to perform the activities that once were easy to do. We'll say because her right dominant hand was affected, Jackie is no longer able to write, drive, dress herself, and other things that really were vital. She comes to an occupational therapist to perform different activities to get her back to her functional tasks. Now let me talk about a physical therapist and occupational therapist. Physical therapists work on ambulation, which is their functional task, having the patient be able to walk up the stairs, gait training, balancing, being able to walk a few feet. It's all about ambulation at the end of the day, which is their functional task with the physical therapist. In the case of occupational therapy, we focus on ambulation. Now listen to this one. Ambulation in walking to the bathroom, which is a functional task for occupational therapists. Walking to the bathtub to take a shower, which is a functional task because we focus on self-care. There are many things that occupational therapists do with walking that is functional. So getting out from the bed into the wheelchair, from the wheelchair to the chair, those are all transfer goals, right? That occupational therapists focus on, because eventually we want them to get out of the wheelchair, be able to do things on their own, become independent, be able to do functional tasks that they're no longer able to do. We want them to do all these things on their own. The main thing that occupational therapists focus on, activities of daily living, right? Which includes self-care, includes grooming and hygiene, dressing, toileting, as well as bathing. Those are very important factors for someone to become independent, okay? So many people confuse that when it comes to occupational therapy. Also, another side note, occupational therapists are usually confused with occupation, which is within the word occupational, and it totally makes sense. Yes, we do focus on occupation that the person was doing before they had the disability or are with the disability, before they had the injury or condition that caused them. At the end of the day, occupational therapists do not provide jobs. That's not our profession. Yet we do focus on the occupation that the individual once had and trying to get them back to their previous life. Thank you so much for watching. Please subscribe if you haven't yet. Please share with your friends, coworkers, and other people that may actually benefit from this. Bye!